G'day, Chris Showalter, Program Director.
Bryan O'Halloran, Senior Faculty with MAPS.
Excellent. Take a little bit more look at the unilateral assessment in the lumbar spine. So if you take a look at a plastic spine and you take a look at the anatomy, if you drop off an interspinous space, you drop off over a space, and it's effectively the posterior joint line. So you can palpate in there. You could go slightly inferior and you'll find yourself over the lamina. You could come out a little bit wider over the TP and you can affect the TP. In the Maitland approach, the most important thing is not calculating where you are, but finding where you can recreate the patient's exact symptoms with the least amount of force, the so-called comparable sign. So I'm out here over the TP, mobilizing the TP, and Bryan wanted to have a word to you about what not to do out there over the TP.
So I think a common mistake that people make is they get very much over the lateral aspect of the transverse process and they produce a noxious response. Patient says, that hurts. All right, so first question, does it actually have relevance? Is it reproduction of their comparable sign? In the vast majority of circumstances, it's not. It's simply an adverse noxious response. Our purpose is not to produce an adverse, nociceptive, painful, nasty feeling without any relevance to movement. Our purpose is to reproduce the comparable sign or, well, reproduce the comparable sign with the least amount of force in order to move pain further into range, or do that which is relieving, easing, low-grade movements, grade 1s and 2s for a neurophysiological response. So our next interest is considering transverse mobilizations. So I'm on the lateral aspect of the spinous process, and this would be from right to left. So this would be a left transverse mobilization. In this circumstance, very often we would consider the appropriate direction of movement to consider would be pushing in the direction of the pain. Very useful as a lower grade tool, but as with any movement, we have the opportunity to change the grade based upon the response. All right, thanks very much.